That is precisely what I said in the initial phases before I went into Servilon. I used to use the product along with so many of these products. It was as a result of that experiment that I finally discovered that Servilon alone is working and all the others are co-prescribed. I was trying to eliminate, suppose we are prescribing 7 items, why not 6? Why not 5? Why not 4? I cut it down, finally just this one, and found that that one was still doing its job.
Then why are they co-prescribed? Then also the synergism can be there when they are co-prescribed.
I am not contradicting synergism at all because Servilon itself is a synergism. There are so many herbs, I am not contradicting the effect of synergism at all. Because if you have an inflammatory component, if you have to do something which is anti-inflammatory. What I am saying is in the chronic condition, we still continue to prescribe a lot of things. If our Siddhanta is very clear, if you have to do Rutshanam, then do Rutshanam. Don't club Rutshanam and Snehanam and Shamanam and this and that because we are not clear, we are administering everything. If you are clear that you want to do Amabhajanam, do Amabhajanam. And then if you are clear you want to do, say anti-inflammatory effect, you want to do that, then do that. And if you decide you want to go in for anti-degeneration, just do anti-degeneration. You don't have to mix 10 products for anti-degeneration. It's because very often we are not clear what we want, we try to have this and that so that somewhere you're throwing a big bunch of pebbles so that one of it will go and hit. Fine, as long as the patient gets benefit, it's fine. As part of an academic exercise, I was trying to do this trimming and see what's happening. Very often I used to even simple things like, we want to have a camp for osteoarthritis. Immediately if we ask for a list, what will happen? If as doctors we are asked to write a list of medicines that we want for an osteoarthritis camp, we will write at least 50 products in our list of products that we want. You keep it there and finally you conduct a camp for 100 people and see how many of those have been used. You will find there are 6 products which are used. Conceptually we think we need this and that and that and that, but finally we all fall into patterns of writing just a few set of products. It could be XYZ, it could be ABC, it could be MNX. But finally we set into a pattern. If we start analyzing the pattern, we are able to shrink the pattern further and finally we find out that though we would ideally like to treat at the Hetu Viparita stage, at the individualized stage, very often we are becoming doctors who treat a Vyadhi. Because that is what the patient wants at that point of time. If a patient is saying, okay, I want to be healthy, now you do what you want to do. We can do everything, but does a patient come to us? Very few patients come to us like that. They come to us saying, I have a headache, I want you to treat my headache. And at that point, you are treating headache and not that patient. This is what I am feeling, but ideally as Ayurvedic doctors, we would do much better if we were allowed to treat the person. So we would treat his headache and also avoid so many other things. Please.
Does it imply that you don't have implicit faith in your product called Servilon? Because does it imply that you don't have implicit faith in your own product called Servilon? Please patiently listen to what I'm telling you. Does it imply that you don't have implicit faith in your own product called Servilon? Because you said Servilon itself has some synergism. Then why do you combine it with other drugs? Can't you give it alone?
I think Dr. Ramesh was initially mentioning before he had a product which he is right now using alone for all the conditions. Even before that, he used to prescribe multiple medicine. Kashayams, Aristams.
Dear moderator, I have to interrupt you also with the permission. He said Servilon itself has got a synergistic effect. Then can't he use it alone?
He is used alone.
He is using it alone.
He combines with other drugs also.
I said.
He used to do that earlier, now he is not using. And he was very ethical, he never used the...
I'm not speaking just about Servilon, leave alone. I think we'll just cut off Servilon from this topic. But what I'm trying to say is, when we look at a whole gamut of things that we are doing, ultimately, because I don't want to make it look like a marketing talk for Servilon. That's why I want to cut off Servilon. When we talk about a whole spectrum, what I'm saying is we can finally narrow down to a common denominator. Servilon, currently for your information, I am using Servilon only. And the study which I have done is of the use of Servilon alone as monotherapy. One was Servilon alone and only internal administration of Servilon, and one was Servilon with an oil for external application. This is the protocol I did the study on, and I found that Servilon alone itself is able to do significant improvement, but with oil the relief is coming a little faster. I am sharing that data with you. Yes, please.
Maybe the last question, please.
Sir, I am very sorry to say this. We started the program with the finding the lesion in MRI and finally ended with the finding lesion in Ayurveda. Finding the lesions in Ayurveda. We started the program with finding the lesion in MRI and finally ended with finding the lesion in Ayurveda.
I don't understand.
We started with finding the problems in MRI. We ended up in finding problems with the Ayurveda itself.
No. I
So
don't.
we
think
have
it's
to
a-
understand the basic principles, sir. We have to understand the basic principles. There is in Ayurveda, in modern medicine, we say it is not scientific because even a osteoporotic patient is coming and we are prescribing one medicine. About 100 patients of osteoporotic patients are coming, we are prescribing one calcium tablet or one painkiller and it is enough. But the patients are 100 patients are coming with 100 variety because one patient may be coming with burning sensation, one may be coming with this guruta or heaviness, one may be coming with one pulling type of pain. All these are different. That is why Ayurveda is called so scientific because one is vataja, one is pittaja, one is kaphaja, one is avaranjanya, one is kevala vataja. All are different. So we should have different medicines. Not only single medicine can help in all the patients.
See,
Then it is Ayurveda is foolish. Ayurveda is unscientific.
Yeah,
Then why we are telling Ayurveda is scientific? You are yourself judges sitting in the panel and making Ayurveda as foolish science. We are not agreeing because we are sitting here. We are not sitting as we are foolish here. We are making you as judges, as the panel people, saying that Ayurveda is scientific and you should prove it. Ayurveda is scientific, not as unscientific. Yes. He said right? Yes.
If that this thing was addressed to me, then I would like to answer that. What I was trying to say is that's not what we should do. Even I was trying to tell the same thing, that there are Vyadhi Viparita approaches and there are Hetu Viparita approaches. What does Ayurveda say? That ideal method of treatment is the Hetu Viparita treatment. It is not the Vyadhi Viparita treatment. What I am trying to say is generally what we tend to do is to get into Vyadhi Viparita treatment as a pattern. Ideally, what I am still suggesting, I am 100% with you on that we should not be treating just the disease. We should ideally treat the whole person. And in that case, it cannot be the same medicine for everyone. We are not treating just cervical spondylosis. That is not the job of an Ayurvedic doctor. We are supposed to restore absolute health in that individual, which is not just cervical spondylosis. As he was saying, cervical spondylosis is the tip of the iceberg. Why cervical spondylosis? If you look at that, there are 100 reasons why gradually they developed into cervical spondylosis, from Sanjayan to Pragobam to Prasaram to Sthana Samshrayam. Finally, you have got cervical spondylosis. What I was also trying to say is, but then juggling between just the Dhanvantaram Kashayam and this thing is not actually doing a Hetu Viparitam, is what I was trying to say. Because by looking at an MRI to decide between just 2-3 Kashayams is not Hetu Viparitam. We have to go to the very, very fundamental cause, because you cannot say that if the MRI there is a bulge, then use Dhanvantaram Kashayam. If there is a herniated disc, use Prasaranyadi Kashayam. That's not the way these Kashayams are delineated. They are meant for basically correcting the pathological process at a different level, originating from different fundamental hetus. At the Bhuta level and at that level, we need to understand these drugs and what the condition is, and that is the real Hetu Viparita Chikitsa, which I am for. That is what Ayurveda is supposed to do. If I have given a note that is not what we are supposed to do, I apologize for the same.
But you have not done, sir. Then another one question is, in case of IVDP, there is Dr. Ravishankar Parvaji who is practicing in Puttur. If you are not knowing him, you can have one speech with him, or you can talk with him, or you can go with him, that he is successfully treating IVDP, acute IVDP. Even the patient will come in stretcher with the KMC, and within 2 days he will make the patient all right and he can able to walk. The patient MRI then suggests that IVDP is there. After treating also IVDP is there, but subjective feeling, patient is able to walk. Patient is able to walk where the treatment is given as per the basic principles. That is what Ayurveda can be able to treat a patient with just basic principles. That is what basic principles should be needed, not the MRI or X-ray or anything.
Thank you, doctor. I would like to make it clear that nobody was contradicting the basic principles of Ayurveda. One thing. Secondly, we are never promoting a product or never not trying to not to understand the successful practitioners like Dr. Prabhaji. The purpose was to give an overall clarity regarding the disease conditions, its examination, and also diagnosis, differential diagnosis, and the treatment, which I am sure that in the past 3 presentations it was done perfectly well.